Hello everyone, I'm Dr. Ala Musbah, Professor of Obstetrics and the Gynecology, Faculty of Medicine, Mansoura University. The topic of my lecture about urinary tract infection in pregnancy. Okay, we'll start with definition, his etiology, types, asymptomatic bacteria, and what are the roots of urinary tract infection, and then the cystitis and pyelonephritis, representing lower and upper urinary tract infection. Let us start with the definition. Of course, urinary tract infection is one of the commonest medical complications during pregnancy. Can be classified as lower or upper. Lower as acute cystitis, upper as acute pyelonephritis. Of course, bacteria considered a very important predisposing factor for lower and upper urinary tract infection. Okay, why pregnancy is a risk factor for urinary tract infection or urinary tract infection increase during pregnancy due to either mechanical compression leading to urinary stasis because of the growing uterus has a mechanical compression over the ureter causing urinary stasis. Also, the effect of progesterone hormone causing relaxation of smooth muscle of the ureter, which becomes dilated and there is urinary stasis. Also, there is vesico-ureteral reflux during pregnancy. What about castration done during labor? Also is a risk factor for infection. And during the postpartum period, there is a changes in the bladder sensitivity and bladder over distension, which may predispose to urinary tract infection. So, the types of urinary tract infection may be asymptomatic bacteria. The pregnant lady has no symptoms but has infection. And the other category is symptomatic bacteria, which is more dangerous, like cystitis and pyelonephritis. Okay, let us start with asymptomatic bacteria. What is the definition? It is defined as the presence of positive urine culture in an asymptomatic person. Okay, in other way, presence of pathogens more than 100,000 colonies of the same species per 1 ml of urine in freshly voided midstream specimen. Okay, it affects 2 to 7% of all pregnancies. Why it is important? Because it may be associated with some adverse fetal outcomes, like preterm birth and increased risk of low birth weight infant. The management of asymptomatic bacteria by giving the patient the proper antibiotic according to the culture and sensitivity test. A 7-day course of treatment is sufficient. I should say that screening is important in the first antenatal visit for asymptomatic bacteria by doing urine analysis and the culture during the first antenatal visit or between 12 to 14 weeks pregnancy. Okay, this is different lines of management like amoxiclav, like cefaclor, like fosfomycin. Okay, all these antibiotics given for 5 days or 7 days, this is enough. But fosfomycin is given in a single dose only, 3 gram, given oral in a single dose. Okay, nitrofurantoin is not preferred during the first trimester, and also sulfa, also trimethoprim, is not preferred because there is some reports about complication, fetal complication, if it is given during first trimester. However, the amoxiclav and the cephalosporin and the fosfomycin is considered safe. Okay, let us complete our work about the roots of urinary tract infection, how the organism reach the urinary tract through the either blood-borne or ascending through the urethra, bladder, and the ureter. Also, don't forget the vesicular reflux, which occur during pregnancy. Also, it may happen through direct spread from the colon, especially the right kidney. That's why the right pyelonephritis is more common than left one. Okay, the organism include E. coli, commonest one in 85% as in non-pregnant lady also. Other organisms like Proteus, Klebsiella, Staph, Streptococci, Faecalis, and Pseudomonas also may be considered. Okay, what are the symptoms of urinary tract? It depends. Is it lower or upper? In lower urinary tract, usually the symptoms include frequency, dysuria, suprapubic pain, maybe low-grade fever, but in upper urinary tract infection, there is fever, rigors, line pain, dysuria, and sometimes clinical symptoms and signs of septic shock, and this is very dangerous. So let us go to the pyelonephritis with its incidence 1 to 2% of pregnancies. Pyelonephritis is more in the right side, as I said before, and it may be bilateral in up to 25%. What are the risk factors of pyelonephritis? Abnormalities or stone of the urinary tract, previous episode of pyelonephritis, in some medical diseases like diabetes mellitus, sickle cell disease, and AIDS. Complication of pyelonephritis may be fetal or maternal. In fetal complication, there may be abortion or miscarriage, preterm labor and the premature rupture of membrane, intrauterine growth restriction, and the intrauterine fetal demise. While the maternal complication may include septic shock due to effect of endotoxin, pulmonary injury, also due to endotoxin effect on the alveoli, causing its damage, which may present as respiratory distress syndrome or pulmonary edema. Also, acute pyelonephritis may become chronic infection, causing chronic pyelonephritis, which leads to renal impairment and renal failure at the end. Endotoxin also may cause anemia, and this anemia resolve after proper treatment of pyelonephritis. What about the investigation, lab and radiological investigation? As regard lab investigation, you should remember to do screening for all pregnant ladies for asymptomatic bacteriuria between 12 to 16 weeks or at the first antenatal care visit. Urine analysis and the culture is done, as I said, for screening of asymptomatic bacteriuria. The urine sample is taken, should be midstream after cleaning of the perineum in order to minimize contamination by skin flora. Okay, so we started with the urine analysis and the culture. Okay, whatever as a screening for asymptomatic bacteriuria or in patient complaining of lower or upper urinary tract infection. Okay, also I need, especially for upper urinary tract infection, to do CBC, there is leukocytosis, serum electrolytes, serum creatinine, and the blood culture may be needed in certain conditions where sepsis is a concern. Okay? What are the radiological investigation in pyelonephritis? I may need ultrasound. Yes, ultrasound evaluation for evaluation of renal tract may be needed where pyelonephritis recurs or is slow to respond to treatment or to identify renal anomalies or renal stones. What is the pharmacological management? Pharmacological management will depend on culture and sensitivity test to give the proper antibiotic for the organism causing urinary tract infection. And you should take care that antibiotic chosen should be safe as regard to avoid any fetal anomalies or complications. So, what are the regimen can be given for cystitis, for example, like amoxiclav 625 milligram TDS for 5 to 7 days, or cefaclor 500 milligram for 5 to 7 days. Okay, so there are different regimen. Fosfomycin can be given in lower urinary tract only, not in upper. 3 gram oral dose, single dose, not repeated. Okay, nitrofurantoin 100 milligram every 12 hours for 7 days, but you should take care that nitrofurantoin not preferred in the first trimester. Also in patient with glucose 6-phosphate deficiency. Okay, after you give the proper treatment, take 1 week rest, then do again urine culture again. Okay, to be sure that the organism is treated. Okay, what about pyelonephritis? Pyelonephritis needs hospitalization most of the cases. You should give the patient intravenous fluid and antibiotic according to the culture and sensitivity. And this antibiotic given intravenous at the start till fever stop after 48 hours from stopping of the fever, then continue with oral antibiotics. Okay, you should lower the temperature if there is high fever using cooling blanket and acetaminophen. Also, patients should be monitored closely for the development of worsening sepsis. This is a regimen for the pyelonephritis. You can start with ceftriaxone 1 gram daily till 48 hours afebrile, then oral cephalexin 500 milligram every 6 hours for 10 days. So the treatment here is 10 days at least, okay, with this regimen. Okay, cefazolin, another regimen, cefazolin 1 gram every 8 hours until 48 hour afebrile, then oral cephalexin 500 milligram every 6 hours for 10 days. You should complete the treatment as mentioned here. Okay, is there is any prophylaxis for urinary tract infection? Yes, we can use non-pharmacological or pharmacological one. As regard the non-pharmacological one, like cranberry juice, can decrease the number of urinary tract infection over 12 months. Okay, you can give the patient cranberry juice daily. Glass of cranberry juice is protective. Why it is important to give prophylaxis for urinary tract infection? Because the recurrence rate of pyelonephritis is nearly 20% during pregnancy or the early postnatal period. So it is important, okay? Is there antimicrobial prophylaxis? Yes. Nitrofurantoin, amoxiclav, and cephalexin was suggested as a prophylactic antibiotic to certain person, high-risk person, like whom? Like pyelonephritis in this pregnancy, occurrence of pyelonephritis in this pregnancy before, or known renal structure abnormality leading to urinary stasis and repeated infection. Also, patient with recurrent urinary tract infection. This is the last slide. Thank you. I want to remember you about my textbook published on Amazon at the January 2022. You can find OBS and the Gynae textbook there. Thank you.